President Donald Trump declaring a national public health emergency to combat the opioid epidemic that claims more than 100 lives a day.
Beyond the shocking death toll, the terrible measure of the opioid crisis includes the families ripped apart and, for many communities, a generation of lost potential and opportunity.
Overdose deaths involving prescription opioids have quadrupled since 1999. Today's emergency declaration means states and federal agencies will have access to more resources to fight the epidemic. Reporter Monica Sampson is looking into how those resources will impact Arizona.
Governor Doug Ducey declared a statewide health emergency for Arizona because of the opioid crisis back in June. Cronkite News spoke with those on the front lines fighting the epidemic, and they say President Trump's actions today doesn't go far enough.
In Arizona itself, we have about 2 people a day that are dying from opioid-related overdoses, which is a pretty significant tragedy.
This public health emergency doesn't go as far as a national emergency declaration would have. While it encourages different agencies to work together, it doesn't automatically provide funding to fight the crisis. Congress has to take action to provide more funding. Toxicologist Dan Kwan of Maricopa Integrated Health says while we wait for lawmakers, more people could be at risk.
Opioid addiction or opioid use, let's say, and even in someone who's never taken opiates, is death.
Dr. Brazzi says the most important step in fighting the opioid epidemic going forward is open conversations, saying we need an integrated approach to medicine like therapy and group counseling.
I think, continuing to get the word out is critical, and so I think that was an important first step today, the announcement. I think also, ultimately, treatment for this does cost money, and it would be great for the government to really look at making sure that there's appropriate funding for people to receive MAT services, which stands for medication-assisted treatment.
Also a concern, the amount of heroin and deadly fentanyl still coming into our state.
So I think we're seeing a great deal of the fentanyl product, which is kind of an emerging issue for us. Started off with the opioid issue with the prescription opioids, then we switched over to heroin, but what we're seeing right now is a lot of the fentanyl product that's coming in specifically in the pill form to meet that burgeoning need for opioids amongst our addict population here in the United States.
One way to help reduce the use of opioids is to get rid of unused prescriptions you have at your home. This Saturday is the National Prescription Drug Take Back Day, and there will be more than 40 drop-off locations around the state. In the Broadcast Center, Monica Sampson, Cronkite News.